Hey, we're at HINZ 2012. This is the Gen I stand. It looks absolutely amazing. This year we're showcasing Virtual Clinic, which is a technology that we've developed in conjunction with the Central Cancer Network. It's about delivering better, sooner, more convenient care to cancer patients, and it means that the patient is actually at the centre of the conversation, and their cancer physician, their GP, their community care worker, and all those who are involved in their care can actually have a conversation via video conferencing using an iPad, a tablet, an iPhone, a standard virtual meeting room from anywhere in the country at any time, with a patient at the centre, and support them through that continuum of care journey.
We've effectively taken the complexity out of providing the technology down to the user level. It's affordable, it's scalable, fully managed, fully supported.
What we're seeing and expecting coming up is that there's going to be a big uptake of video conferencing in healthcare for things like supporting remote clinics, for doing patient supervision such as speech and language therapy, mental health interviews, that sort of thing, and also besides avoiding clinician travel, there's also the increased collaboration as the DHB's regionalised. So we're seeing that it will make a big difference.
So what Virtual Clinic does is it leverages the connected health network created and endorsed through the Ministry of Health. Now, this supports over 500 healthcare organisations around the country. We can now provide those healthcare organisations with a virtual meeting space that's private, secure, where they can share and collaborate with each other at a touch of a button.
So Gen I provide a 24-hour dedicated video conferencing help desk, which allows customers to call us at any time. We also provide a concierge service, a bridging and bureau service, where we can find rooms all over the world for customers to turn up for interviews. We can bridge the different technologies together over various networks, and also we have some core engineers that we can send out into the field who can go on site to install and to troubleshoot on site.
We're big users of telehealth, really, and we're not just using it for meetings, and we're not just using it for consultations between medical staff, but we're actually using it in a clinical setting so that our patients in Christchurch, our doctors in Christchurch, can run a weekly clinic in the West Coast for the oncology patients. They talk to the patient on the video conference, and then the patient goes straight into having their chemotherapy or whatever. So it saves a whole lot of travel by the doctors, but it also saves travel by the patients themselves.
So look, as Gen I, one of our real key value propositions to a customer is that we're a trusted advisor. That means that we can supply equipment, and we're vendor agnostic, that we can supply both Polycom and Cisco in terms of the video conference equipment that we are providing here. Plus it's that whole end-to-end solution, so not just the devices, but it's the devices, the connectivity, the software, the whole virtual clinic proposition end-to-end.
Well, South Island's been looking to a multidisciplinary meeting process for some time, and it's actually starting to go live. It's very exciting, actually. We're looking forward to being able to bring in general practitioners desktop to desktop and straight into hospital waiting rooms. I'm certainly looking forward to being able to collaborate with my colleagues in Christchurch from Dunedin almost on demand without having to book a room out, and it's going to make a big difference to the way I work. Hopefully it'll reduce my airfares as well.